Hello everyone, this is Dr. Dimitrios Nasioudis from the Hospital University of Pennsylvania. It is my pleasure to summarize our study titled Adjuvant Treatment for Patients with FIGO Stage 1 Uterine Serous Carcinoma Confined to the Endometrium. In this retrospective study, we accessed the US National Cancer Database and identified patients diagnosed between 2004 and 2015 with a malignant uterine tumor. The National Cancer Database is a hospital-based database that prospectively captures 70% of all newly diagnosed cancer cases in the United States. Our cohort was limited to patients who had uterine serous carcinoma that was FIGO stage 1 and disease limited to the endometrium, as well as patients who had hysterectomy with at least 10 lymph nodes removed, as well as patients with data on adjuvant treatment. In our study population, the majority of patients, 48.7%, did not get any type of adjuvant treatment. 20.7% got chemotherapy only, 20.4% chemoradiation, and 10.2% radiation therapy alone. Following generational Kaplan-Meier curves, patients who had observation only had worse survival compared to those who had chemotherapy only or chemoradiation. After controlling for patient age, presence of comorbidities, history of another tumor, and other confounders, compared to observation alone, patients who got chemoradiation or chemotherapy alone had better survival. However, there was no difference between the radiotherapy and the observation-only group. Limitations of the present study included the lack of central pathology review, lack of data on tumor relapse, as well as the chemotherapy regimen that were administered, as well as the size of residual disease was not available. In conclusion, in a large cohort of patients with uterine serous carcinoma confined to the endometrium, approximately half of them did not get any type of adjuvant treatment. However, patients who got adjuvant chemotherapy with or without radiation therapy had better survival compared to those who had observation alone. This study should be regarded as thought and hypothesis generating, and our findings should be validated in further prospective studies. Thank you for your interest in our paper.